Verizon iPhone time. Oh, they're on strike.
I'm going to hit start broadcast, so you have to do *1.
Ready? Good afternoon. Welcome to this afternoon's webinar on EAP's role as a valued added benefit. My name is Jeff Carr, and I am pleased to be your moderator for this afternoon. A few rules and a few housekeeping rules. All attendee lines and phones are muted. Questions can be asked at any time using the chat feature in the lower right-hand side of the control box. Questions will be answered at the end of the presentation, and we will have time for Q&A. And this presentation will be available for replay. We will send out information post-presentation on how to access this presentation via audio. Some information about today's speakers. I'm pleased to have with me Joe Roche. Joe is the Executive Director of Inova's Employee Assistance Program. He's been the Director of Inova EAP for 30 years, and he has a variety of experience in serving employers across the United States and leading EAPs. The next speaker I'd like to introduce and give some background on is Joe DeRoma. Joe is the Vice President of Total Rewards and Workforce Planning at Inova. He's responsible for all human resources and benefits at Inova, and he has a vast, many years of experience in HR and benefits working for healthcare and outside healthcare. Some information on Inova Health System. Inova serves more than 3 million people each year. We have more than 15,000 employees that work for Inova Health System. Our hospitals and our clinical operations have a variety of awards, some of which you'll see on the screen, named America's Best Hospitals continuously for the past decade. Inova also serves over 3,600 employers from all 50 states, delivering a variety of corporate health services. A little background on Inova's Employee Assistance Program. It's been in existence for 35 years, again, serving clients not just stateside, but international. The retention rate, you can see there, the satisfaction rate has been north of 98% consistently for the last 20+ years. And again, it's a global program, and I'm pleased at this point to introduce the gentleman who founded and is responsible for Inova Employee Assistance, Joe Roche.
Thank you, Jeff. Good afternoon, everybody. This is Joe Roche. I'm going to walk you through some of the information on Inova Employee Assistance. And we're going to start off this afternoon by just taking a look at what are some of the costs related to mental health and substance abuse, which are really some of the drivers for the EAP industry and the growth there. As we take a look at those costs, as you can see on the slides in front of you, when we look at treatment costs for mental health and substance abuse on an annual basis, we see that spending in the United States is north of $170 billion annually, which makes up a little over 7.5% of total U.S. healthcare spending in the country. When we look at just depression on its own, we can see that that's costing the average employer in excess of $1 million annually. And when we look nationwide at the lost productivity to substance abuse and mental health issues on an annual basis, we're north of $105 billion, and we're looking at about 217 million lost workdays in any given year. So obviously there's a major expense there. When we look at the study done by the National Institute of Mental Health, one of the things they were able to show us is that 1 in 4 adults in any given year is going to have a mental health or behavioral health problem that's going to cause them some difficulty. The solution that most employers have put into place to deal with behavioral health and mental health problems are really employee assistance programs. And you know, we've been around for a number of years. Actually have our roots in industrial alcohol programs that started in the 40s and 50s with some forward-looking companies like DuPont and Kodak. And today we have really 4 primary EAP models that exist that employers have put into place. And you know, when you think about an EAP, a lot of folks don't realize that there really are some differences on how they're set up and how they actually operate. So EAPs traditionally started off, they were primarily all internal programs put into place by large employers. And this is a program where you're going to hire your own staff, you're going to have people that are working for your organization, and they're going to be delivering EAP care to not only your employees, but also their family members or household members as well. A second model that we see that's pretty common is the same thing. We have an internal model for the EAP program. The addition, or kind of the additional twist on this, is that in addition to having the internal staff, they'll frequently hire an outside vendor that provides EAP services that gives them some expanded capabilities. So they'll put that in place on top of that. And typically in those programs, the internal staff will take care of kind of the high-profile, high-touch cases. If there's a critical incident or a traumatic situation in the workplace, they'll deal with those. They frequently deal with manager or supervisor referrals around performance and attendance problems. And they'll many times deal with, executive and leadership issues that, when those individuals might be looking for EAPs. A third model that's very common today is to have the EAP baked into an insurance product. On our slide here, we talk about a health plan, but in reality, we see a lot of different services that are available through, or a lot of different insurance products that offer an EAP. One of the ones that we see that's very common in today's world is disability policies. And then lastly, we're looking at a standalone EAP. That's an organization that's really built a product to an EAP product to sell to the employer community. So when we look at, what are some of the advantages and disadvantages of each of these models, there are pluses and minuses to each, as you might expect. And when we look at the internal program, probably the greatest pro that we're going to see with that population or with that style of program is it's really a very high-touch program. You've hired employees that are dedicated to your organization, that, we're going to assume they're well-engaged employees, and they're really focused on delivering for the organization and for their employees, the very best that they can do. And one of the advantages that an internal program is going to have, they're going to have a lot of flexibility. So, if they typically see an employee 4 or 6 or 8 times and, they've got somebody in that needs a couple of more visits, that's not a problem, and they can generally just continue them on. Some of the cons with the internal programs is they tend to be very expensive. You've got usually a small group of people. In some companies it's one person, in other companies it's a small team of people that are delivering the EAP services to your employees. So you have challenges around, you're paying those folks, you're providing them office space. There's also some issues with confidentiality. One of the things we know is that when we look at these internal programs, they tend to be very confidential, but sometimes the employees or the participants question, is this really private? They know it's part of human resources, or maybe it's part of employee health, and they just want to, so some folks are going to be reluctant or resistant to utilize the EAP program in those scenarios. The third challenge we see is access to the EAP program. Since they're generally small teams, typically they answer the phone Monday to Friday, kind of 8:30 to 5 when the company's open for business. They generally have a single location, or maybe they have one employee in each primary location. I know a train service that's got, they got an employee in the Northeast, one in the Southeast, one in the Northwest. So they're not physically friendly to a lot of folks, and they might not be friendly to family members that need to come in after hours. So there's some access challenges. If there's an emergency after hours and on weekends, child away from college, you see those kind of things. The internal EAP with the contracted staff, they provide a very high-touch product as well, so that continues to be a pro. And they've really increased the provider access. So, they've overcome that problem I just talked about with, the access challenge. The other thing they bring to the service is there's really a broader scope of service. So typically they're going to start to incorporate some of the benefits. The internal programs tend to focus on behavioral health issues exclusively, substance abuse, depression, anxiety, grief, loss, things like that. When they bring in that vendor, they're able to start to add broader scopes of services, legal, financial, and ID theft care, many times child care, elder care, daily living service, where they can help with a whole variety of issues. When we look at the cons on those models, they still have the challenges financially. They're much more expensive than contracting with somebody in the community, and they still have that confidentiality issue. When we look at the one that's baked into your insurance product, their biggest con, their biggest pro is they're very inexpensive. Sometimes they're free. Sometimes they're baked right into that insurance product that you buy, and whether you want that service or not, it's in there, and the price is not going to change. So they're very, very low cost or no cost at all to the employer. And the other thing is they're really very easy, because many times they're turned on automatically. So your employees have access to them no matter what you've done, whether you've signed up for them or not. When we look at the cons on the insurance-based products, there's a couple of things that happen. There tends to be little to no marketing of these products. So a lot of times the EAP program's in place and employees aren't even really aware of that. There's really not a dedicated account manager who's going to be providing, who's going to be that liaison between your workplace, the organization, and the EAP to kind of smooth problems out, to keep things moving forward, kind of your go-to person. And as a result of that, what we typically find is utilization for the product that's baked into insurance tends to be very low. On average, we see about 0.5% of 1% of employees taking advantage of that baked-in insurance product EAP. The last option we have is the standalone EAP. There's a couple of advantages there. They tend to have a dedicated network. At Inova, we have 60,000 providers. They're credentialed exclusively to do EAP work for us. They're not credentialed to be part of a mental health network for an insurance plan. Our contract is really very specific to them around delivering EAP services. There tends to be a higher level of utilization. There's a lot of promotion that generally goes along with most of the standalone programs. So we do see there's a lot of promotion that keeps the program out there in front of employees, and we see better utilization. Like with a product that adds a vendor on, there's usually a much broader scope of services. Again, it's going to include things like legal services, financial consultations, ID theft, child care, elder care, pet care, employee discount programs, a whole host of things. And then if you have a good vendor, you should have strong account management. You should have somebody that's really your primary liaison back to the EAP, that has a knowledge and has an understanding of your business and what your organizational needs are, and is really the go-to person for you. When we look at what are some of the cons in that with the standalone EAP, they're definitely more expensive than the insurance-based products, and there's no way they can really match the high touch of an internal EAP program that we're going to be looking at. So the next slide we're looking at here really shows you how prevalent each of these models are in today's world. And we see that, internal programs, even though they dominated the market 20 or 25 years ago, today they only make up about 7% of the EAP market. 24% of customers or organizations do that internal EAP with a vendor laid on top. That tends to work well for very large employers. Obviously, that doesn't work nearly as well for smaller employers. About 29% of EAPs in today's market are integrated into some kind of insurance product. And then lastly, we see about 40% of EAPs being delivered by what I'm calling a standalone EAP. So what are the benefits of an EAP program? And, really, why does an organization want to have an EAP? And there's really a couple of reasons for this. They're good for business is the bottom line. We're going to go through some data here when we'll take a look at, why employees are not coming to work. And, we had a study that was done that looks at 1 in 5 employees who call in sick, they're actually stressed out rather than physically ill. And so it's that stress that's keeping them away from the workplace. HR Magazine did a study, and they say that half of employees cite stress and personal issues as the most common reason for their work absence. In America, on any given day, we've got about 30 million Americans who are somewhere in the grieving process. And we know that can have a dramatic impact on an employee's ability to function, to be present in the workplace, and to be productive in the workplace. When we look at a study done by JAMA, depression, when it's effectively treated, it can actually reduce absenteeism by 4 days for every case that we're looking at. And this is a statistic that actually surprised me. I've done EAP for 33 years, as Jeff told you, and we've had a legal program built into our EAP and a financial program built into our EAP for many years. But I was really surprised at how positive the impact was in this study that was done by Mark Attridge. And, when we look at avoiding work loss, we saw that in 39% of the cases, and they saw improved productivity in 36% of the cases. So there's some real strong incentives. And lastly, the last bullet we have, I think, is actually one of the best incentives. When you think about it, when we look at illegal drug users in the U.S. today, 75% of them have jobs, and they're working for organizations like yours and like ours. So when we look at that return on investment, there's a number of things that EAP programs can do for you. When you look at an EAP, and if you bring a good EAP into your organization, they should be able to resolve about 90% of the problems that your employees bring to them up front without feeding that employee back into the insurance product. So they solve that internally. And so that really reduces the number of referrals to insurance, and as a result of that, has a financial impact on the organization. It saves you money, and it reduces those costs that are tied, because if you're buying an EAP and you got a large percentage of your cases getting fed out to the insurance network, you're paying both that EAP product as well as the insurance vendor. And one of the things I encourage organizations to look at when they're in the organization, when they're looking at purchasing an EAP, is to actually take a look at how frequently the EAP they're looking at refers those employees out to insurance. Because what some EAPs do is they come in at with a very competitive price, but they drive a lot of those costs back to you through the insurance product. In addition to saving you as the employer money, a good EAP, if they solve 90% of the cases internally, that does a couple of things too. It decreases the out-of-pocket for your employees as well. So they have no copay, which we know our employees like. The other thing, which is really a large driver that I don't think a lot of people think about, is there's a large percentage of people that are very concerned about having a behavioral health claim on their insurance plan. And if they're able to deal with that in the EAP, that really doesn't become part of their medical record. So that's a real incentive for some employees to want to stay within the EAP rather than go outside of the EAP. When we look at costs, what Robert Wood Johnson Foundation did a study, and they looked at the cost of mental health care and the cost of medical care for employees that had depression and those that didn't have depression. And when we looked at, the average monthly cost for an employee that wasn't depressed, we saw those costs at about $20 a month. When we worked in or added in the depression, we saw those jump up to $130 per month. Similar experience with medical expenditures. They run at about $840 a month. When we looked at employees that had an issue with depression, they jumped from $840 to $1290. So when you look at those overall monthly costs, they went from $860 to $1420. And so what you're looking at there is for every employee, every patient that's got depression, every employee and covered family member, you're looking at an additional cost of about $560 for each one of those individuals. So, what are some of the other value added benefits of having an EAP, a quality EAP? And one of the things that a good EAP can do for you is they can improve employee engagement. When we look at, an EAP that provides high-quality, high-touch services for your employees, they have the ability to create a lot of goodwill. Employees are pleased by that. They feel like they've been served by their organization, and, it tends to have a positive impact. It also can help the employees and their household members cope with a whole variety of services that or situations that may not fall under your health insurance plan. All of a sudden I've got an emergency need for child care, or interestingly enough, today I received an email from a customer that I've been working with for probably 15 years who wanted to let me know she was going to be leaving the organization. Her mother had a stroke and she needed to care for her. So, they've had an elder care situation pop up. Or, maybe there's a legal issue, a landlord-tenant issue, a financial issue, or an ID theft issue. And we can help them deal with those kind of things. And again, it creates that goodwill and creates that employee engagement. They obviously also provide employees tools for dealing with behavioral health problems. So we see things like depression, anxiety, grief, stress, substance abuse, provides employees tools to deal with all of those. We can help both employees and managers in the organization cope with stress. And then when you look at, the cost of EAPs. And it's interesting, I've been doing this for over 30 years, and one of the things we've seen is with efficiencies built into the market and with changes, the pricing for EAP, I can honestly tell you, we sell an EAP today for, less than we did 30 years ago. So, we've seen prices continue to come down. And on average, we're going to spend about 1/3 of 1% on the EAP benefit of what we're going to spend on our health insurance dollars. So sometimes a wise decision on the EAP side can help you save some dollars on the insurance side. And, a little more around cost avoidance and saving money for the organization. EAPs can reduce both absenteeism and unplanned absences. And, we need about 60% of cases, and with an average of 17 hours per case. So when we look at those employees who are participating in the EAP, we see improved work productivity. 72% of people report, improved productivity, and we're able to measure the average gain on that at about 43%. One of the key drivers is employee turnover. As part of our presentation later today, Joe DeRoma is going to take a look at, turnover costs, and how we help by here at Inova. And, so, that's an expensive venture. We get an executive or any employee, we bring them in, we make a significant investment in them, recruitment, training, and it costs us a lot of money to turn them over. We can also help with employees that have had, they've been away from work for a period of time, whether that's a short or a long-term disability or there's been some other issue going on. You can really utilize that EAP to help transition those employees back into the workplace. And lastly, it can be a great tool for helping you really utilize that health insurance benefit that you're already using, that you're already paying for. One of the things that a quality EAP should do for you is help you identify early on employees that are having personal problems, behavioral health problems. If we can get them referred to the EAP, we can improve the likelihood that that problem is going to get resolved. We can also improve how quickly that's going to get resolved. And we can help with the whole case management process of navigating the insurance system. Another thing, kind of shifting gears here, you want to think about is you want to look at, are your employees pleased with the EAP program that you have in place? And we've measured customer satisfaction over the years for many years. And one of the things we found over time was, and we made a change back in 2015, because even though we provided a link to a Survey Monkey to every client who used the EAP, and we gathered an email address and we encouraged them to participate in that, we had a really hard time getting a reasonable number of people to take 10 minutes or 5 minutes and complete that survey and get it back to us. So at Inova, we switched to a very brief survey that we do over the phone, and we're interfacing with a client over the phone. At the end of that call, we ask them if they're willing to take a brief 3-question survey for us. What we found is that our participation rate really went up significantly. And here's the 3 questions we ask. They're very simple. Did we help? And here's our overall data for 2015. You can see over 99% of employees indicated, yes, we were helpful. Do you feel that we cared about you and your request? And we're at about 97.5% on that. And then finally, we ask them, did your company make the right decision in hiring us to provide this service for you? And again, we're at about 97.5%. The last thing I'm going to take a look at before I turn it over to my colleague Joe DeRoma is we're going to look a little bit at utilization. And this is Inova Health Systems utilization. As Jeff told you at the beginning of the presentation, we have approximately 15,000 employees. So we had a little over 15,000 eligible employees last year. And this takes a look at our data for those employees who participated. As you can see, we circled both the EAP cases and the work-life cases. There's a couple of kind of utilizations that we see in EAPs today. And one of the things that's very common in the EAP industry, it's not common, it's just a reality, is that, EAPs tend to count their utilization differently from one another. There's not an accounting standard like you might see, with the CPA. But what we do is we take a look at, every individual, every case that we do, we count one individual. And as you can see, for our behavioral health cases, our EAP cases, stress, grief, loss, depression, anxiety, substance abuse, we get about a little over 2.5% of employees participate in the EAP for those reasons in 2015. When we look at our work-life cases, again, legal, financial, ID theft, child care, elder care, pet care, a whole host of things like that, we see we're up just slightly under 3%. So what I call a real utilization rate for the EAP here at Inova, for Inova Health System, we're at about 5.5% of our employees. They reached out to us, they made a direct contact with us, and we delivered EAP service to them per their request. Now in today's world, we have a lot of other services and actions that are available through the EAP that we do track, and we provide that data back to our colleagues in human resources. But we really view that as a little differently. So if you take in, for example, if you take a look at our web logins, you can see that we have almost 13% of our employees who have plugged into our website. But you can do a lot of things on our website. If you're looking for child care, you can call us up and we'll search that for you. If you're like my spouse, you know, they really want to drive that car by themselves, and they're going to go onto the website and they're going to pull that data up, they're going to do the search, they're going to call the providers on their own. So we had about 13% come in and utilize that. When we look at workplace activities, those are really employees who were touched by the EAP, generally in a group setting in the workplace. At Inova, we do a lot of what we call critical incident debriefings. You know, there's been some kind of traumatic situation in the workplace that's negatively impacted a group of employees. And the kinds of problems we see vary from industry to industry. At Inova in 2015, we actually had an active shooter situation in one of our hospitals. You know, that created, as you can imagine, a lot of concern, and we provided a lot of work and did a lot of support around that process as well. But we do a lot of debriefings around unexpected patient deaths, violence in the workplace, employees passing away unexpectedly, things related to terrorism. We did a lot of work after 9/11 for all of our customers, for many, many of our customers. And so, you know, we see about 0.5% of our employees participating in the EAP, maybe participating in the training that's conducted by the EAP. So when we look at our total utilization, you know, we're just a little shy of 19%. But again, that real utilization and what we focus on are those 5.5% of employees that actually reached out to us and requested direct assistance from us through the EAP. At this point, I'm going to turn the presentation over to Joe DeRoma. Again, Joe is our Vice President for Total Rewards here at Inova, and he's going to share some of the Inova-specific data with you.
Thanks, Joe. So as Joe mentioned, I am going to get into a few return on investment numbers. For everyone on the call, I just wanted to, as the HR guy, just fill everyone in a little bit more about Inova so you have a sense of, you know, the employee population that we have here. So, you know, it's our flagship hospital is a 900-plus bed level 1 trauma center here in Fairfax, and we have 4 additional hospitals in Northern Virginia, as well as dozens of outpatient centers, which include several freestanding ERs as well, in addition to the ERs that are in the hospitals. So there's plenty of opportunity for stress and depression and some of the EAP items that Joe previously mentioned here at Inova. Okay, so with that, I'm going to get into some of these numbers here, which I think really overall are, if anything, a little on the conservative side. So if you consider, I'm on the return of productivity, so if you consider, you know, 15,000 employees here at Inova, you know, what we think is a pretty good benchmark number as far as distressed workforce during the year at any one point. And then, you know, basic assumption of a 20% productivity loss due to that stress. Joe mentioned 5.5% utilization rate, so that's what that is based on our EAP and work-life cases. So, you know, we come up with, you know, and again, based on a $65,000 average annual wages, which is, again, for this calculation, we do not include executives and physicians. If you're a healthcare system, you probably are starting to employ a lot of physicians these days, as we are, but just for purposes of this, that number's on it. If it was, it would be more in the high 70s, I think. So, so with those assumptions, again, we're looking at, you know, cost of reduced productivity without the EAP and the 20% productivity loss around $23.4 million. By having that our EAP in place, and the cost of that, we're looking at like basically $18 million. when we look at the estimated return of productivity, which basically looks at the 65% that we're assuming took counseling, the cost that it took to provide our EAP program, take that out of it, we're still looking at almost $5.5 million just based on productivity. Okay, I'm going to move on to turnover. Inova, we're running around a 15% turnover rate, a little bit higher than that at times, but in terms of high risk to leave their job, our assumption is it's annually it's running around 15%. And of course we've got replacement costs for whenever somebody leaves. Again, I think 1.5 times, especially when I'm looking at a nurse, as fairly conservative. So if I run through those numbers, basically the cost of that turnover and the savings we get from the EAP basically is about $7.8 million. And then if I look at our success rate for our EAP, again, we're looking at a cost of savings around 4.2 with a net savings of 3.6. Okay. And then last one we look at before we sum this is savings for short-term disability. Again, we see 9 to 11% of our employees take an STD leave at any time during the year. Generally, those leaves average around 8 weeks. And so again, taking those figures, using the $65,000 base salary cost, we do look at a savings just about $500,000, just based on getting people back to from short-term disability or avoiding it altogether. Okay, so the last page I'm going to review is just summing up those three costs, so those three savings that we just discussed. Again, total savings around $9.5 million, which, as you can imagine, more than pays for our EAP program. Okay, I'm going to go ahead and turn it over to Jeff just to sum up the presentation, and I think we're going to take questions after that.
Absolutely. Thank you, Joe. Some takeaways before I open it up for questions. And again, for those that have questions, please just go ahead and submit them, and I will get through as many as we can, and we do have time for questions. 4 takeaways that I'd like to talk a little bit about and spend some time on. And Joe did a great job at presenting mental health claims and associated costs continue to rise for most all employers. Work and home stress, along with legal and financial strains, play a key role in employee productivity, as well as presenteeism. An engaged, accessible EAP should be providing significant return on investment to you and your employees' families. You are paying for this benefit, and as we all know, it can be a reflection of your organization on the provider that you choose and the benefit that you offer. Employees should be satisfied with how the EAP interacted and assisted them. Joe Roche gave some examples of a short survey and the effectiveness of that survey. What I'd like to do now is ask my colleagues a few questions that came through, and I'll go through as many of these as I can. Again, if you have questions, please go ahead and submit them at this point. One question either for Joe Roche or Joe DeRoma. How do you, any advice do you have to message supervisors or consult supervisors on the use of an EAP?
Well, I could take that, Jeff. So there are a lot of users. A lot of companies are, keep a close eye on their employee engagement these days, and the things that can take away from that engagement, detract from that engagement, a lot of those can be, we find, addressed through the EAP. And there are things that, a lot of times can happen outside of the workplace, but supervisors keeping, an eye on that, keeping communication lines open with their employees. We try to stress that, keep this as a handy tool to help address some of those issues. It's just something like anything else. You have to look at ways to keep it in front of employees and managers, to reminding them of it.
Excellent, thank you. One question came in. I'm thinking this might be for Joseph Roche. Is any idea what the national average for utilization of an EAP is?
National average on EAP is a little bit of a mystery, but one of the things we do know is that, you know, and again, it's going to depend on the product, but frequently today, I think we see it in more in the 2.5% to 3% range is where we're typically seeing EAP utilization.
Excellent. And the next question, I guess, could be geared towards either Joe DeRoma or Joe DeRoche, but how does, I'm assuming it means our EAP, how does our EAP integrate with other vendors, other healthcare benefit vendors, whether that's insurance, some other vendor benefit that you have? How does that flow together and integrate, if at all?
I can start that one out, and then Joe, if you want to jump in, that'd be great. We have a feature that we call Benefits Connect in our EAP, and it gives us the ability to gather information on all of the benefits that an employer may offer. And there's really two advantages to that. One is we can centralize that data on our website for all employees to access. But the other thing we do is we integrate that into our case management system so that if an employee is utilizing, let's say, for example, Jeff, somebody calls us up and they're looking for emergency child care, and their employer has a relationship with the company that provides emergency backup care. We're going to say, yes, we can do a search for you, but did you know that you have this benefit through your current employer? And frequently he isn't aware of that. And what we can do is then if that vendor's open, we're actually going to warm transfer that employee into that vendor and do a handoff so that they can receive that care immediately. If they want us to kind of do a search on top of that, obviously we can do that as well.
Excellent.
Yeah, I think, yeah, and that's a very valuable tool for us, Joe, that I know some of our employees use here. And I think that's pretty, the thing people think about the most, I think, is the mental health and substance abuse benefits a lot of times. And what we have found is when employees use EAP and they go to those first 1 or 2 or 3 initial meetings with counselors or wherever the case is, then they're, either that counselor is, they're aware of their health plan, the employee brings that information, and the referral is just, it's an easy referral over the health plan, and the information transfers very, very easily. So
thank you.
Yeah.
The next question has to do with critical incident debriefings, and I guess it's maybe more of a contracting question and maybe a value question, but what value, and Joe, you did talk a little bit about this in your presentation, what value do critical incident debriefings have, and should they be part of the standard pricing or contract? So two-part question.
Two-part question. The value that they have for the organization is when you have a traumatic situation that impacts a group of employees, when you're able to provide a critical incident debriefing, one of the things you're able to do is for many of those employees, you're able to help them process that situation. And what that does is that helps them not get stuck there, and it can relieve or alleviate the need for individual treatment or care for those individuals. The other thing it does is we always, when we do a critical incident debriefing, we always do an educational piece around the EAP, so that if in fact somebody does need to take advantage of the program, they're going to be aware of that benefit. The last thing we do is we ask them, would it be okay if we followed up with you in a couple of days? And if they give us their permission and they provide us with their contact information, we'll actually reach out to the employee, see how they're doing, and just make sure everything is on track and that they're feeling okay. The second part, should they be included into the standard EAP program? We used to do that on a more regular basis, and one of the things we find is depending on the organization and kind of the scope of their work, the need or desire for CISDs can really vary. And when we bake those in automatically, what we found was for some employers, they were paying for a service they really didn't need or utilize on a regular basis. So we found that if we did it on an a la carte basis, it was actually more cost effective for them.
Excellent, thank you, Joe. And I've got one more question, and this question is about utilization. So how often should I get utilization information from my EAP provider?
Well, my answer would be as often as you'd like. You're the customer, so you should really set the parameters for what you want. What we typically do, and this actually works for over 99% of our book of business, we provide a utilization report on a quarterly basis. And typically what we've done is, we used to, many years ago, at the beginning of each year, give you Q1, Q2, Q3, Q4. And what we find is that when you're looking at a year's worth of data, it really makes it a lot more clear what the actual participation and the value, the ROI is on your EAP. So we provide all of our customers with a rolling year of data, so you're always going to be looking at the last 12 months, and so that's going to get updated each quarter, and you're going to get that, generally, so we're just ready to, we just closed the quarter in March. We've got reports that will be going out in this current month in April to all of our customers.
Thank you, Joe. At this point, I'd like to conclude our presentation on EAP's role as a value-added benefit. I want to thank all our guests for attending today. I want to thank Joe DeRoma and Joe Roche for leading our presentation. This audio presentation will be available post today. We will send out information via email on how to access that for your colleagues in your workforce. Once again, thank you and have a wonderful afternoon.